I'd like you to ask yourself the following question. If I'm unable to make a decision for myself, if I'm unable to speak for myself about medical decision making, is there someone that I trust who can? One of the most important decisions we can make as individuals to be prepared for the future is to designate someone a healthcare agent, or otherwise known as proxy. This is a person with whom we've spoken to, who knows us, who would know what our values are, what our priorities are, and if we are unable to speak for ourselves, would be designated to make certain decisions for us based on what we have told them about our priorities and needs. I'm speaking of decisions like, would I really want certain treatments if they weren't curative? Would I want to be put on a breathing machine if the chances were slim that I would ever return to my previous life? Would I want my heart started with electrical shocks if it stopped? If you've asked yourself that question, do I have someone that I can trust to speak for me under those circumstances? And the answer, like most of us, is no or I'm not sure. Then the program that's about to follow is very important and has excellent information that you will find very helpful.
Hi, this is Dr. Shelby Cooper. I'm a physician at the Bassett Medical Center. I appreciate the introduction comments by Dr. Hyman preceding this. Today, I'm going to be moderating a discussion on advanced directives, focusing today on the why aspect of this. Joining me today will be Dr. Carol Beachy, internal medicine physician at the Bassett Medical Center, Bruce Hellstrom, chaplain at Helios Hospice, Mickey Rixmeyer, a local community member, and Lexi Pugliese, Bassett RN. I'm going to ask a series of questions of the group. I'll start with Carol, and I'll let you lead this off, Carol. Carol, what are your thoughts on this, the why of advanced directives? Why is this important?
I'll start with why I did it. And the first time I did it, any advanced directives, was when I went off to Africa to work. And it suddenly hit me that I was vulnerable and things could go awry. And I wanted to be sure that people would turn to the person I had talked with most about what was important to me, how much I'd be willing to go through, what sort of quality of life was something that I would be willing to continue to live in. So I did a healthcare proxy, and that's really I think, probably the one that we all should be doing. Who is it that you would trust to make healthcare decisions for you? But you can't really let them just with that. You owe it to them to talk about what's important to you. How much would you be willing to go through? And that really came home to me with this most recent COVID public health emergency. And I thought about how much I'd be willing to go through. And suddenly I was willing to go through less than I would have been 20 years ago or 30 years ago. I knew the data. I knew that if I got COVID, I was of an age that I'd be at risk for a serious COVID. If I got COVID and was intubated, it depends who you looked at, whether you had a 20% chance of going home or a 50% chance of going home. The numbers are all over the place, but it's not good. But if I were intubated and then had cardiac arrest, I died, there would be no point in putting me through an attempt at resuscitation. So I did my what's called a MOLST form and said, in this setting, I know it wouldn't be useful and it would put my colleagues at increased risk, and I did not want to do that. So that's sort of where I come from at a beginning.
Great, thanks. I appreciate those comments. Mickey, as a community member and somebody that has some understanding of this. What are your thoughts on this? Why do you see this as important?
Well, I can just share the experience that I had with my mother, who was elderly and who was very clear ahead of time. We were fortunate in that, it wasn't a sudden death, and we had a lot of support. But it was just so wonderful to know how she felt and to have talked about it before she was in a situation where she couldn't talk about it or she would be confused. And that was just a tremendous gift for us to have, and enabled us to be able to spend the time with her that we had left in a really positive, meaningful way. And we were all on the same page because we knew what she wanted, and it made it just seem like the right thing to do.
Absolutely. And then I'll really offer the same to Lexi and Bruce. Do you have any stories that highlight the importance of this? I know you both have a lot of experience in this and experience working with patients.
Yes, if I could just chime in. I occasionally work with, and I'm a chaplain. I occasionally work with a person who struggles with the religious and spiritual implications of advanced directives. Some look at it possibly as a lack of faith in God. They want to put themselves in God's hands, and I can appreciate that very much. But I just point out that they have hands too. They have responsibilities. And it seems to me that of all the major religions in the world, all have produced outstanding physicians and pioneering medical scientists over the centuries, and that's true now, and I believe it'll be true in the future. So I would just encourage anyone who's struggling with the religious or spiritual aspects to give them the green light. They have to decide for themselves, of course, but I see no conflict between faith and reason, and it seems to me medical science is a great blessing. I just encourage people to talk with their physicians on their concerns and their preferences for end-of-life medical care.
Great, thanks. Lexi, any thoughts?
Yes, I feel that you need to make these decisions before the crisis occurs, because when you are sick, you are already terrified and often incapacitated. I have seen when it's least expected and when it is expected, and folks aren't prepared. I often say, if you don't do it for you, do it for your family and your loved ones, to prevent the emotional burden of wishing they knew what you wanted and help lessen the fears when surrounded with possible death. No one wants to live with that guilt.
Absolutely. Anybody from the group have any comments on pitfalls of not doing advanced directives early? Any stories that might highlight that situation? I'm sure there are plenty.
Lexi, you're
I'm not.
nodding.
Well, in my experience, knowing and understanding what you want for your advanced directives and making sure you communicate it with your healthcare proxy or proxies, doesn't necessarily have to be a family member, is crucial in preventing the conflict or prolonging any suffering. It's important to know that, your wishes aren't always set in stone, that you can change based on any experiences that you might have. It's really impossible to have all your scenarios planned out ahead of time with what you might face. And just knowing that, making sure you have all of this laid out with the right person to advocate for you. And that's kind of my role as well here, is to advocate for the patients. will help prevent any, conflicts along the way.
I think part of the reason for needing advance directives is because we can do a lot with medical care. Mm-hmm. Sometimes it's miraculous. Sometimes, we rescue someone from the brink of disaster, but we can also do a lot to just prolong suffering and prolong dying. And I think it's in those settings that it is heartbreaking to watch families struggle with this and get angry at each other and mistrust. And in that setting, I'll say, well, if your father could be here, if he was sitting in that chair, what would he say? Well, people will have different thoughts about what he will say, whereas Mickey's mom said it. And she said it before she became disabled and confused. So I think that if you don't do it, you do lay a tremendous burden on your family or your friends or whoever loves you, and you lay a tremendous burden on them. And as Lexi said, people then struggle with guilt no matter what decision they make. Right. But it's also not a one and done. I'm thinking about a young woman with advanced cancer that was really, she had kids, she had grandkids. She was pretty young, even though she had grandkids. And she had early on named her husband as her proxy. At the beginning, she said, I don't want much done. But then she realized there was a lot that we could do to give her a good quality of life. And she really loved her life and loved her family. And it was never quite time to say enough is enough, I want to die at home, until it got very toward the end. But she had already started to think about what were her values, to talk with her family and her about what was important to her. And so when it came time, it did cost her an extra admission to the hospital because she hadn't been cleared before. But then we were able to turn around and help her meet her goal of dying at home, supported by hospice. Or there's someone who says, I want everything done, but at least people are clear about what they want. And I think putting it in the context of, while we can do a lot of things in medicine, they are not always beneficial. They may simply prolong suffering.
Right. I think you really highlighted an important aspect of this, which is how personal this is, and how individual this is. Everybody's going to do this differently, and everybody needs to do it differently. And you need to think about it when you're thinking clearly. And that is obviously before you get in the hospital and are sick and things are more difficult then. Carol, Dr. Beachy, Bruce did touch on the religious and spiritual aspects of this. So I know you've spent some time on the ethics committee at the hospital and have some real understanding of that. Do you have any insight or comments on any ethical issues or dilemmas that might be thought about or considered in relevant with advanced directives?
Well, I think we, as part of medical ethics, we look at benefiting people, we look at not harming people, we look at focusing on what they feel is their quality of life rather than us defining that quality of life. And we focus on justice, treating people equally. So there was a lot of concern, and I think some reality down in New York City about what you do if you run out of respirators or whatever. But most of the time, we don't have to cope with that here.
Right. Yeah.
What is more likely that we'll have to cope with is how much are you as a patient or you as a family willing to go through when it's often a fair amount of suffering. And if there's going to be a good outcome, then everyone's going to be happy with that. If it's not going to be a good outcome, then that's another issue.
Yes, and I've noticed too, so many ethical dilemmas occur because of insufficient information, just not knowing the intentions, the preferences of the patient. So I think we all have a certain responsibility to provide as much information on our preferences as possible. I think that might cut back on some of the dilemmas anyway, and they can be really wrenching at times.
Right.
But that also has to be balanced with what is possible. You know, we talk about the medical community bringing the where are you at with your illness and what is likely, what is possible. But we really depend on us as the individual who's sick or the family member or, to bring their values and what would be a quality of life that they would enjoy. You know, there's a lot of data to suggest that most of us would like to die at home, not on a machine, with people we love around us. But if we don't have these conversations and we don't think about it, it's always too early until it's too late.
Right. That's very true. Lexi, I want to ask you a fairly simple question. I know we're not going to get into the nuts and bolts of how to do this today. There's another webcast coming that's really going to get into that. But how long does this take? Is this something that you can do in 5 minutes, or is this something that's going to take hours of time to do? Just you give us a little perspective on that.
Yes, it depends on, you know, if you've had these conversations ahead of time at all with your doctors to understand your health and any questions you might have and what's important to you. That's key before you really can fill out one of these forms. And I know working in the ICU with the doctors that I work with and Dr. Beachy and the palliative care team, they are all very good at making sure the patient after an experience in the hospital understands that. Once they understand that, there is paperwork that we can complete. It comes in the admission packet. If they know who they would like to appoint as their proxy or proxies, again, it doesn't necessarily have to be a family member. It has to be somebody that can, in stressful situations or difficult situations, speak for the patient and their voice. So once the patient has that information, who they would like to designate, we can fill out paperwork that actually only takes probably 5 minutes to fill out. And once that is filled out, there's a witness. It is witnessed by two people that are not on the form. They get a copy is placed in the chart, and the proxy can be given a copy as well. And that's literally all that is required for a healthcare proxy.
And notice it doesn't require a lawyer. It doesn't require a notary public.
No.
Yeah.
But the key
There
is
are
knowing what, understanding your disease processes, knowing what you want, and making sure whoever you appoint is somebody that can reflect what you want when you are unable to make those decisions.
Great. Mickey, I haven't heard from you in a little bit. Do you have any further thoughts on this topic?
Well, I can say that I appreciated so much the medical staff who took the little bit of the fear out of talking about what was inevitable. You know, it just isn't something that anybody is really comfortable with, talking about death, and yet sometimes the more you talk about it, the less fearful you become about it. And part of what I think was being able to accept, you know, for us with my mom, she was elderly, she was uncomfortable, so that was, you know, that helped in that way. But the big part that helped was that we were able to feel that we were doing what she helping her to achieve her wishes. And my great fear was at certain points she was transported, and I wanted to make sure that nothing happened in that interim where she wasn't treated with the respect and dignity of her choice of how she wanted to be treated. So
right, yeah, communication.
Liberating for us.
Communication is vital, and it's obviously something that we all need to strive for in all these situations. Is ongoing communication between the medical staff and the family, and that's absolutely a vital aspect of this.
There are a couple of, if I could just say, there are a couple of resources that I think are really helpful. You'll hear more about these, and I think we're going to have them on the end of the webcast. The Conversation Project, 5 Wishes, these are 2 different things. They all emphasize communication and talking about values, not talking about, well, I want to be on a ventilator for 3.5 days.
Right.
And then Atul Gawande's book, Being Mortal. If people haven't read it, I would really encourage you to read that.
Great. Any other thoughts? We're running out of time here, but if anybody has any other thoughts, feel free to add.
I talked with a daughter today whose mother is dying of cancer, and decided that she'd had enough. And again, because we didn't get this decision in quite enough time, she's in the hospital, but will be going home with hospice. And she talked about this time being hard but precious. And if we've had the conversations, if we've made it clear what we want, and it will be a process, but then that time, even if it's hard because we know we're going to lose someone we love, it's precious time.
Yes.
And I think you talked about how precious, Mickey, things were with your mom.
Mm-hmm. That was true. It was a real gift for us. And so I felt very fortunate in that respect.
All right. Well, great. I really appreciate everybody joining in on this discussion today. Again, there'll be another webcast coming up on the nuts and bolts of how to go about making this work. Please join us for that. Thanks a lot.